Hi there, my name's Carly Seibel, and I'm a physical therapist and a neurologic resident at Creighton University in Omaha, Nebraska. I'm here today to discuss a physical therapy intervention called high-intensity gait training. If you're someone who's experienced a neurologic injury, such as a stroke, an incomplete spinal cord injury, or a traumatic brain injury, you may have heard about high-intensity gait training from your physical therapist, and you may be wondering if it's right for you. Today, I'm going to talk about what high-intensity gait training is, what it looks like and feels like, and what it can do for you. So first, what is high intensity gait training anyway? Well, it's pretty simple. It's walking practice. It's almost unfortunate that it's been named high intensity gait training because a lot of times people hear high intensity and they think high risk, but that's not the case. High intensity gait training is walking practice that's completed at increased cardiovascular intensities. That means with a high heart rate. The reason that we do this is because intensity is one of the principles that we use to promote what are called neuroplastic changes. Neuroplasticity is our brain's ability to change and adapt based on the stimuli that it receives. Intensity isn't the only principle that high intensity gait training utilizes. There's also repetition and specificity. So basically, repetition is the number of times that you practice something. In high intensity gait training, you'll take a lot of steps. And specificity is how close what you're practicing is to what you want to improve. So if we want to improve walking, we practice walking. High intensity gait training is intense enough, repetitive enough, and specific enough to help improve your walking. But walking speed, distance, and quality aren't the only benefits that you'll get from high intensity gait training. Evidence has also shown that it can help improve your balance and your transfers to help with overall function. What will high intensity gait training look like and feel like? Well, it'll look like walking practice, but your physical therapist may change or modify things about the environment or the activity to make sure that you're working at high enough intensities. First, they'll calculate the intensity zone that's right for you. They'll do that using your age, maybe your fitness level, or your medications that you're on that could impact your heart rate. Your zone will either be 60 to 80% of your heart rate reserve or 70 to 85% of your heart rate maximum. Once that range has been calculated, your physical therapist will do everything they can to make sure you're working up into those intensities. That might mean that they add resistance, such as ankle weights or resistance bands. It might mean that you go up or down stairs or over soft, squishy surfaces, maybe hurdles. They might change the assistive device that you use or increase your speed or distance. There's a lot of things that they can vary to make sure that you're working out hard enough to be causing those neuroplastic changes. What will high intensity gait training feel like? Well, it'll feel like you're getting an intense workout. That means that you'll see those increased heart rates, you'll also see an increased breathing rate, and you might sweat. These are good signs that you are reaching those high intensities that we need to make the neuroplastic changes. But don't worry, physical therapists are experts at monitoring and modifying exercise to make sure that it's safe for you. First, they'll make sure you have medical clearance from your physician that says that high intensity exercise is safe for your body. Then they'll monitor you the whole time to make sure that your body is responding the way that we want it to. If you're curious on if high intensity gait training is appropriate for you, please ask your physician. And if you have more questions about what it might look like or feel like, reach out to your physical therapist. Thank you for listening.